Corona center your face.
Oh, we got something for you today. Welcome to the Demand Better podcast, your ultimate consumer's guide in the health, fitness, and wellness space. We are sponsored by Fit Care Physiotherapy and Wellness, where the emphasis is to focus on your fitness so you can avoid the healthcare space. Listen, people, you're going to need to buckle up and get your popcorn ready because today's Demand Better podcast is about to drop some serious knowledge and inspiration all over you. I'm straight out of the concrete jungle and joined by my esteemed co-host, Dr. Bo Babenko, coming from the frozen tundra of Colorado. We're welcoming a guest who's got a story more epic than a Rocky montage. What's up, Bo?
What's up? We got It's a Sin going. Special request, Pet Shop Boys. I got my Coney Island 5K representing.
That's nice.
Gotta have my New York representing.
That's nice.
And I'm just going to share that Jeff and I share a birthday. Not the same year, I'm going to point out. But same exact day. And we exchange videos wherever we are on that day, back and forth every year on Facebook. And here we are now. This is the first time I think we're actually interacting in a very long time. I would say over a decade.
Probably. Yeah.
Probably. And Corona done brought us together. So Corona, tell us who, why, when, where, how.
Well, ladies and gentlemen, it's Jeff Berman. The man's not your average Joe, from foster care to Fairleigh Dickinson lacrosse defensive stalwart. Jeff's already defied the odds before his 21st birthday, but then life threw him a curveball, CLL, a chronic leukemia. And that said, party's over, buddy. But Jeff was like, not on my watch, cancer. He ran marathons, built the FORCE program to beat cancer with movement, and is presently one of New York City's top commercial real estate brokers. This is a story about grit, resilience, and proving that when life throws you a lemon-sized medicine ball, you can make some kick-ass lemonade. So get ready to be inspired and empowered, and maybe a little teary-eyed. This is Jeff Berman, and his story is about to demand better from your life. What's up, Jeff? Drop some knowledge.
How you guys doing?
Listeners.
Hey, man, how about them Cowboys? I just love it.
Well,
that's my story.
Podcasts live on for a long time, so I want to give people reference that today is the day after the Cowboys done got destroyed by the Green Bay Packers.
Hang on, I'm going to show some guns and be a Pat McAfee for you today. That's just what you need. Should have went in the gym before and gotten jacked like he does.
Well, that's right. Well,
we can be doing push-ups right now as we.
Well, this is going to be a wild ride, so let's buckle up and get ready for the Jeff Berman experience.
Oh yeah, and so on my left and my right, your left, your right is my birthday brother, Bo Babenko, and the brother in the crack, David Corona. Not on crack, in the crack.
That's a story we'll get to when we get there.
I want to hear that one.
That's a true story. Jeff,
yeah.
So listen, man, I know your story pretty damn well, and you've been through a lot. I've known you for over 30 years. Let's really start, man. First of all, I didn't know you were in foster care, number one. I had no idea about that. And I also didn't know. I knew you played lacrosse. I didn't know you were the defensive stalwart, as it's put out there. But I really want to get going right in 1990 when you come down with CLL, because that has been kind of that's been a staple in your life that you've overcome. So let's start there.
Well, the interesting part about that is it's still there. It's still a chronic disease that you can't cure. Even, 34 years later, we haven't been able to cure it. We put it deeply under control, put it in a giant sleeper hold. It's like almost non-existent, but it's there. So that really was the catalyst, because it was this ongoing lifetime, living now more than half my life with this disease. So it had to become like I had to learn to not enjoy living with it, but I had to learn to live with it. It was like you do everything you want to it. you could just beat the living hell out of it. But there's still a little tiny piece there. So, that really was what got me going. And so, the foster care piece, which you didn't know, is I was there for 3 years, but it's part of what I call the reservoir. So when I need something, even back then, 4.5 years old, there's a place to go. There's a place where you've been. There's a dark place you've been. There's a place where, people abuse you and they beat the shit out of you and they didn't feed you. And it's like, at least now I get fed and, a few guys kick my ass and, I deserve what I get most of the time because I do it to myself. But the COL of 1990 was, I was like, oh shit, what is this stuff? And I researched the shit out of it. I did everything I could, talked to as many people as I could. When the surgeon did the biopsy, he refused to call me back. So it took a whole weekend. He was out driving around in his Porsche somewhere. And so it was my doc who called me 4 days later. Actually, he brought me in his office. He's got his head down like this. And I said, what's the matter? He said, I hate seeing my patients get sick. I said, well, I ain't getting sick. This is not a problem. And so that put me on this pathway. It derailed my career in a good way. It derailed another career. It derailed a marriage. And so, because each time you go through it, whether you want to or not, there's sort of if you don't do a life assessment, I think it's a waste of time to have the cancer. So it sort of became something that I had to basically live with, and every so often grab it by the nuts and twist it, with like treatment or whatever, or run a marathon. It's like, fuck you, you're going to stop me from doing this shit? Go right ahead, try. So it really motivated me. And then I saw what was going on with all the other people with cancer who could run marathons. This is how I got introduced to the whole Terry Fox thing, which has been part of my life for over 30 years. And now we're doing a national event. So, and through that, we found a late stage cure for B-cell leukemia through the Terry Fox run, because I was involved with the running community that led me to this nutty Canadian that hooked me up, and the rest is history.
So, do you want to tell the story? Why don't you tell us? You're the executive director now, Jeff. Is it you run the Terry Fox thing in New York, correct?
I have a partner who's a Canadian from a place called Regina. Don't even go there, and that's too easy. And he grew up with a Terry Fox story. And we were introduced through the Roadrunners Club because he wanted to start a run. And so I went to his first planning meeting. The whole committee was in an uproar, screaming at each other for no apparent reason. And afterwards he said, do I need them? I said, of course not. And ever since, we've been doing this as a two-man show. So I do all the logistics. I do the planning. I make sure nobody gets hit by an ambulance. At least I try not. Make sure there's enough water in the course, that the toilets aren't backed up. But what I do is quietly in the background, make sure that the thing runs. And that's sort of my logistic brain that I have. So the way we do it is Ken is the founder and the director, if you will, but I'm the director of all the pieces of the event.
Can you do me a favor and just give a little background on who Terry Fox is, this 19-year-old Canadian? That you can give the background on and what you're running for.
Right. So it's a real easy story. It's one of those stories that stayed with me literally for now 30 years. That means, talk about a reservoir, whenever you need it, it's there. So Terry was diagnosed with osteosarcoma, bone cancer in his, right leg. And back then, in 1980, when he was diagnosed, they amputate your leg. They cut the cancer off where it is. Now, they would have taken a piece of bone out, and they would have taken a piece of bone from his iliac crest in his hip, and they would have stuck it back in. So he decides that after seeing an article about Dick Traum is an above-the-leg amputee who was the first person to run a marathon. Dick is the founder of the Achilles Track Club, and Terry says, because Dick was in his 50s, probably at the time, or 40s, Terry says, if that fat old whale can do it, I can do it too. So instead of running a marathon, he decided to run a marathon a day to run across Canada. And he started in St. John's, Newfoundland, which is 1,600 miles east of New York. And he ran for 143 straight days, generally 14 miles in the morning, 12 in the afternoon, and made it 143 days, 3,339 miles, and just was in too much pain in Thunder Bay, Ontario. And so he stopped. And he went back home to Port Coquitlam, which is, where is it? It's east of Vancouver, small little town. And he passed away 6 months later. And by the time he got to Thunder Bay, and there's only 20 million of these crazy Canucks, he was this national figure. Millions of people, and you can see the videos, millions of people came out in Toronto when he ran through Toronto. Darryl Sittler and the entire Toronto Maple Leafs team ran alongside him. So he eclipsed hockey. He eclipsed everything. And there's a national, it's a national holiday. It's the third Sunday in September. There are over 3,000 runs that take place in Canada. There was one in New York, and hopefully this year we'll have 8. But it's run all over the world. One of the biggest events takes place in Vietnam. And the other sidebar to the story is everybody said when Terry passed, let's go out there and finish the run for him. And Isidore Sharp, who is the founder of the Four Seasons Hotel, a major institution who I've met, luckily, his son had died in 1976 from leukemia. And Sharp said, why don't we set up a Terry Fox run at all of our hotels? Wow. And that's how it took off. So when you come to our run in Central Park, in the band shell, it'll be October 5th this year, there's about 3,000 to 4,000 people, and the Four Seasons shows up in white gloves and serves breakfast. It's a unique, really special event. We also advertise the overall slowest time of any run in Central Park because it's not competitive. For the longest time, we had a clock that had the time of day, and people thought they ran in 15 minutes. It's a 5K. And we've raised over $5 million. We put the screws to Sloan Kettering and said, okay, you're going to get this money, but here's how you're going to get it. You're not going to spend a fucking dime for drapes, heating, lighting, uniforms, linoleum, car, with unrestricted research. So every dollar we raise goes to where it goes, and I have an underwriting group, the Canadian Association in New York. So there are, again, I'm in contact with a few hundred of these runs, but there are thousands around the world. There's over 6,000 around the world, and they're just about to crack $1 billion in funding. And also in the last 12 months, they've put together what's called the Marathon of Hope Cancer Network, which is all of the cancer centers in Canada now speaking to each other. Because in our world, Memorial doesn't speak to MD Anderson, and they don't speak to the Dana-Farber Institute, and they don't speak to Perlmutter Cancer Center in New York, and the story goes on. So all these things go on. All these institutions put every drop of effort into finding cures, and then selling the licensing to drug companies, which is fine because they have the money to really weaponize the drug and get it in people's hands. So so in 2001, when all these events were being canceled, especially in Central Park because of the attacks, my partner looked at me and he said, "What do you think? Do you think we should hold it?" And I looked at him and I said, "Well, what would Terry do?" And this is a man who shows almost no emotion. And he had to wipe away the tear and he said, "Okay, I know what we got to do." So it's really easy. It's a really easy story. And there was like his brother and his friend followed him in a van for 3,300 miles. Wow. And so I every year for my run, create a team and I ride my bike, generally 1,000 miles or more. and I try to raise money. So, and I've been successful. I mean, this year some idiot came up with 30 rides in 30 days. I'm the idiot who came up with it. There were 8 days of pouring down rain, but I was out. Anyhow, and I decided this year, I've always wanted to ride somewhere. So in late July, I'm going to fly to Newfoundland, to St. John's, where I know the person who was on the committee that met Terry when he left for his run. She's 96 and in a wheelchair, but she's all right. And I'm going to ride my bike across Newfoundland to Nova Scotia, take the ferry to Nova Scotia, go across Prince Edward Island, and then across Nova Scotia. So it'll be, I'm hoping, 1,200 miles, and I should be able to do that in 3 weeks. So inspired by Terry. I mean, it sounds corny, you know, and you know me, David. I'm like the biggest cynic you have ever met in your entire life. Oh, did I say, how about them Cowboys? Anyhow, this is my all-day refrain. When you're a New York Giant fan, there's no team you have loathing for more than the Dallas Cowboys. Anyhow, so I'm going to do that. I'll certainly raise $10,000. I may get a few friends to come out and meet me along the course. Newfoundland is 580 miles. And P.S., this is a small promo. If you want to see a really good story on ESPN, 30 for 30, called Into the Wind, go and find that. It was directed by Steve Nash, a Canadian and a basketball player, and it's about Terry Fox's run. Yeah. And in all it came out in 2010. And in all the years I've seen videos and pictures, I saw video I'd never seen before. And it literally, they had I think Terry had cast, like within weeks, they put on a telethon. This is Canada. There were 20 million people. They raised $24 million. You know, not Jerry Lewis, but, you know, they gave it a good shot. But yeah, I mean, think about that.
If only there was a way, Jeff, that we could raise money from the Cowboys choking in the playoffs. If only there was a way.
Somebody had to have had a fund that invested in that.
Bo, take it from him. He'll keep talking. Take it from him, Bo.
That's all right. So you wrote your book. We got the Force program showing up on screen here from 2001. So where you mentioned you started the race there in 2001. Where did the book fit into that? And tell us a little bit about that book. I know it sounds like, based on your reaction, you haven't thought about it maybe in a while.
It's still in my mind. Oh, and by the way, just to go back to the little story about Into the Wind, I didn't know this until I was with Terry Fox's brother for lunch in October. The reason it's called Into the Wind is if you do a cross-country, anything cross-country, basically the winds go from west to east. And so the reason Terry did east to west was he just wanted to do everything he could to show how tough he was. So he ran into the wind. So that's why I can't do it the other way around. Anyhow, so the Force program, I had been doing exercise programs, little stress management program, and always talking about diet and nutrition, always had people into our network. Back then, there was a support group we ran a couple of times a month. And so I'm doing an interview there used to be a YWCA on 53rd and Lex. And I set up my first program there. And I guess New York One found out, did a little story. This slimy, sleazy agent calls me out of the blue and says, "Do you want to write a book?" And I said, "No." She said, "Could you write?" I said, "Yes." She said, "Why don't you want to write a book?" I said, "I got too much shit to do. I'm not going to write a book. I need to run this program." And it took my consultant to call me and say, "How stupid are you?" Of course you want to write a book. So that's what it was. So I collaborated with a friend of mine who writes for Newsday, New York Times, John Hance, and we put a doctor on the label, and we decided to put it in book form. This is 2001. It sounds like, nobody was doing this.
Yeah.
And the subtitle is The Proven Way to Fight Cancer Through Physical Activity and Exercise. So I wanted to ask you a little bit about that, having been in the space for over 20 something years. What have you seen emerge within the literature, the research? Again, I think we're always talking fitness and health here. Obviously cancer, the C word, scary thing, affects, you know, the statistics are mind boggling. But yeah, what have you seen in terms of, you mentioned finding a little bit of a cure for end stage, at least one of the end stage cancers. Yeah, what have you seen in these over 20 years, over 2+ decades, and in that cancer space, of how, and I like the way you guys phrase it, the proven way to fight cancer doesn't mean it's research based, that it's going to actually do the thing, whatever. I appreciate, I'm sure there was some legalities around how you could phrase that.
No,
But
not at all. I wanted to call it the FORCE program, the 10-minute cancer cure, but they wouldn't let me go that far.
well, that's what I'm saying is, like, you can't, if you said cure, you kind of promising a thing. So
I think so.
But I guess
What
that's
can
my
go
question.
wrong?
Being in the space for this long is what, you know, from the outside looking in, it doesn't seem like a lot of progress is being made. The research process you're talking about, that where you're kind of challenging Sloan Kettering of like, hey, we're not, you know, we need you to put this money into research. Research takes time. You know, we see that in all fronts. And just curious, again, what have you seen in these 2+ decades of being in the space, as far as progress, the hope? Are we looking at, you know, we're going to find 5 more cures in the next year, 5 years, 10 years? Give us a little bit of insight there from your perspective.
Well, because I have a little bit more age on you, I was around and healthy and living my life during the AIDS crisis. And the AIDS crisis forced a lot of drug companies kicking and screaming, not wanting to, because, oh, we're not going to help people who are gay. You know, we're going back 80s and 90s. And so it sped up the research process. And ultimately, the NIH, National Institutes of Health, and the NCI, National Cancer Institute, decided that we didn't need to do 1,000-person longitudinal 5-year study about the efficacy of something while fucking millions of people are dying. So they sort of dropped all this. They sped up the process. Sometimes it is a little frightening because somebody will say, we found a cure for B-cell leukemia. Well, the problem is the drug is going to darn near almost kill you in the process. So there's sort of 2 prongs to this, Bo, and it's a great question. What happened with the research? The research does move much faster. In fact, what our money went to is developing something called CAR T cells, CAR T cells. And so CAR is kinase inhibitors, I forget all the wording. And in essence, what it does is it re-engineers a T cell that, for simplification, says to other cells, stop working. Turn yourself off. And it's not even cells. It's the nucleus, it's proteins in the nucleus of cells. That's how granular it is. So when I was first diagnosed, I had heard maybe one day we can do this. Well, 7 years ago, I went on one of these, what are called immunotherapies. So CAR T cells now is a Novartis drug. I think I wrote it down somewhere because I can't pronounce the name.
It's Novartis therapy.
Yeah, there's a name, whatever. So anyhow, so to keep along this line, so we have seen with our money the development of CAR T cells. And about a month ago, Sloan Kettering launched another study for CAR T cells because it was specifically along the lines of B-cell leukemia. And it is what it says. So I have the CLL as a B-cell leukemia. And really hard to sort of get your medicine around it. It's hard to explain, but it's sort of amorphous, and when you do shit to it, it does stuff to itself. So it's like this ongoing thing where you have to try and stay one step ahead of it. So this new study with CAR T cells, 5 people. So one of the things that Sloan Kettering is doing and other research institutes is instead of lining up 1,000 people and giving people placebos, and giving people the real drug, they have 5 people in a study. It'll take them 6 to 9 months, maybe a year to figure out, is there efficacy? Let's expand the study. But meanwhile, then they start to use the product on people who are in a position of what they call being refractory. And refractory means everything else they've tried hasn't worked, or it's worked and it's stopped working. So you're at a point now where you have limited options. So, so we saw that. One of the outgrowths of the FORCE program is I got a call from a lovely New York cancer institution, and they said, we heard about what you're doing. We have a palliative care center here. Tell us what it's about. And as soon as I mentioned the word exercise, they said, our patients are too sick. They can't do that. And I was like, and I said to them, you know what? I feel really bad for those patients. I hope they go someplace else where somebody can help them. Nowadays, when I go to a follow-up appointment at the cancer center at NYU, it's called Perlmutter. When I go there, they actually have brochures on how to exercise. It's nothing special. It's nothing more than common sense. But when I was diagnosed, they were like, that's funny. You think exercise is going to help you, And my oncologist, my hematologist oncologist, who I've been with for 34 years, and who I bust his balls every time I see him and say, why am I back? If you weren't doing chiropractic cancer care, you would have cured me years ago. But you just can't figure it out. So you have to keep coming back and taking my $35. But he was one of the least willing to agree, because he's a scientist, that exercise could be beneficial. And if you look at the book, I mean, what we were doing is we were doing standard exercise, but we modified. So if you're somebody who has balance issues, sit in a chair. If you're somebody who had lung cancer, sit down and throw a balloon up against the wall, work on your breathing exercises. That's all it was. If you're grandma and you love to garden, we want to get you back into the garden. It's not about, and people would say it's not about, they always use, the Lance thing. It's not about being Lance Armstrong. No, they're absolutely right. I mean, my goal was to get back to the physical fitness I had. And it seems that the most recent cancer, I've been through it, I believe, 8 times. And each time I make sure I find a way to get stronger and fitter.
Jeff, let me jump in here, because I don't think people really understand. I'm around you a lot. I've worked with you right around when you came out of the FORCE book was when you and I were in Runner's World.
Yep.
But I think what amazes a lot of people, I looked at your stuff, and I mean, you've run numerous marathons. You ran New York a bunch of times. You ran Boston once for the 100th. And people are trying to wonder, when you think of cancer and you look at people going through treatment, you think of them in bed, not feeling well, and you're sitting out here running marathons. I mean, can you take us through that? I don't know how, I know you. I know if I tell you no, don't go through the fire, you're going to go through the fire. I know you. Mm-hmm. That's who you are. But my question is, when people are listening to it, they're like, this dude's not normal. He's just running marathons. What is it? What is it? I believe in we can heal ourselves, and so does Bo. But when it comes to this stuff, and then people are hearing you, are you special? Is that what people are going to start thinking? You're kind of special because you did all this stuff. So, let us in on that a little bit.
Well, but growing up, people would say, that guy he's special.
different meaning. Different meaning.
Right. Different meaning, and many other phrases passed my way. I don't think I don't at all. I'm like a, run-of-the-mill athlete. I ran, I take generally my marathons were 3.5 to 4 hours. I mean, I got hurt in Boston, it took me over 4 hours. I'm embarrassed. I just sort of slide away. I discovered I am a pretty good cyclist, but it has nothing to do with the physical part. It has to do with the mental part. So when I went through this last bout of cancer, close call, really close call, really frightening. I tried to quit 2 weeks before I was done. I mean, that was the level of pain I was in. And I needed help to get across the finish line, which I've never needed before. It's just what it was. And I got home and I was like, oh shit, how am I going to get it back? I lost 40 pounds. I lost muscle mass. I almost lost my mind. I came really close to a feeding tube. All these things. And it was my wife who said, let's go for a walk. And I was like, nope, I can't walk. Too far, sorry, lost me. Too far, can't walk. My ears are demented. Anyhow. And David, you We lived together. We lived really close. I never knew that there was a hill between 2nd Avenue and Park Avenue. Because the first time I went for a walk to Lexington, I made it as far as Lexington. I said, I want to make a half a mile. I'm like walking uphill. Like it felt like walking up hills in snow in both directions. I mean, it was like, this is horrible. I'm never going to get there. And I went out the next day and I got to Park Avenue. The next day I got to Madison Avenue. Eventually I got inside the park. It took me 2-3 weeks. And by 3 weeks, I was doing a 3-mile walk in the park. You know, I also have a dog who likes to run around. Anyhow, and so I needed a kick in the ass. And then I still wasn't riding, you know, biking. And Cheryl said, let's just go to Randall's Island. I said, you're going too slow. You're going to go too slow. Sure enough, I was right, but she got me out the door. And I did a 10-mile ride. Probably the worst ride of my life.
But better than nothing. Better than sitting at home.
Exactly. That's the point. The whole point is get active, and it really, I think your mind in this whole get well process, besides the obvious part of your mind, reading and understanding, it has to come from your brain to get your body to move. And again, I mean, maybe I'll leave my brain to science, although I'm sure it'll be abnormal. But that's where it's at. And
yeah.
so when it really hurts, you just dig in deeper.
Got to find the way. You got to find the way. You got to find that support system. So, and that's why we wanted to have you on, I think, is to tell that story, hopefully inspire some folks. Again, our whole show is the Demand Better podcast, and we're saying demand better from cancer, from getting that diagnosis, from setting those limitations on oneself of, oh, I got the diagnosis, like that's it. You know, some people push that bit, and again, I haven't been there, knock on wood. But you know, it's again a really encouraging story. And you know, like you said, it sounds like you had that within you, that fire within you from the beginning. But you know, if you had something again to you know, push out to the folks, anyone with a new diagnosis, anyone dealing with things, it sounds like can you sum that up in a few words?
Yeah, well, the medical piece is the smallest piece that you're going to have to deal with. It's very finite. Go get other opinions, that's fine. But at the end of the day, you're going to choose how you want to be treated. But it's all the other shit that you got to pay attention to. What's going on with your body? How are you reacting to it? Do you have to change the time of day you exercise? I mean, what I've always wanted, I told David this, is a exercise prescription. But it's personalized because each person's baseline is different, where they come from. And you know how many inactive people we have. You know, how do you get those people active? It's how you do it is you do it in small, little, tiny chunks. You know, you sit them in a chair. You don't make them stand up. When I teach people how to use a foam roller, I always say lean against the wall because it's going to hurt like hell if you go on the floor. And it's going to hurt so much you're going to quit. And I always find people end up doing exercises that they don't enjoy. You're enjoying being on the treadmill? No, I hate it. Well, guess what? It's not going to work at the end of the day. So you have to find those things that make you happy. I do a crossword puzzle, and now my wife got me on this spelling bee crazy thing, but I do a crossword puzzle at least every morning because my brain needs the exercise. My brain needs to wake up. A lot of us, when you go through chemo, they call it chemo brain. You ask your doctor, wow, I'm really forgetful. And they say, oh, you're under a lot of stress. But when you talk to the nurses or the nurse practitioners, they all say, oh, no, that's real. If the chemo is going through your body, it's going through your brain. So that's my point. So it's in each aspect of your quality of life, which nutrition, stress reduction, exercise, brain exercise, you name it. It's all part of it. And I don't mean to make it seem that it's all encompassing and you have to change your life. You don't. And if you do, you guys know if you make too many changes all at once, you're not going to stick with it. So, I mean, it's hard because I see people who are ambulatory. I see people who are walking around. I meet people who are, luckily for them, better athlete than I am. And there's a different way for everybody, and I think that makes it tough. So if you look at Germany, at Freiburg University, in the 80s, they were teaching exercise. And you go to, I forget the name of the institution, but there's a center in Oslo. Is it in Oslo or Lohen? Whatever. But exercise, yeah, it's Oslo, where again, to reduce the amount of stress on your body, the first thing they do is they have you in a pool. And they have you moving in a pool, doing exercises in a pool, because it gives you buoyancy. It reduces,
makes it easier. Definitely makes it easier.
So, I mean, that's what I mean. I'm not a pool guy, never have been, but if that's what it took, I'd get myself into a pool.
Jeff,
yeah.
I didn't mean to interrupt you. Listen, we were discussing the other day your rolling program, because the whole purpose of this is with Bo's last question, and what we're trying to get people is that we can, like, going back to what I said earlier, we can heal ourselves. You started a rolling program where people thought you were nuts, even including your doctors thought you were nuts, and it's self-care that you give yourself, that you decided to do, that's really, really benefited you and kind of brought you over to a new place. Can you briefly discuss what that was for the reader? Because I don't think people understand what you did in terms of using the roller to try to get the lymph node fluid out of the areas that were bothering you.
Yeah. Like most people, I would dabble with a foam roller, use it once a month, twice a month. And then I had my shoulder replaced. Before that, I had spinal stenosis surgery in 2018. And I had a discectomy in my neck in 2000. Same doctor, same PA. PA said to me, you know what? With your discectomy, once you were done, you had zero pain. You just had to do rehab. He said, but with your laminectomy for spinal stenosis, he said, you're still going to experience pain. He wasn't kidding. And so I was like, I wonder if foam rolling, something I did, would help. And the one thing they said, both of the doctor and the PA said to me, you know what? You're still going to have pain. I got rid of all the pain by just using a foam roller about 10 minutes every day. And sometimes I don't even do it every day. Sometimes I skip days. It's fine. But once you get into a program of rolling on your back, on your legs, on your side, on your neck, and then what happened with this cancer I had in 2022, they irradiated my neck. If you follow, do you guys follow Dick Vitale's story on Twitter? Yeah. Dickie V had it in his vocal cords, but it's the exact same stuff, and he's still not back. He wanted to be back so badly. I communicate with him a lot on this stuff. But what it did was it burnt everything. It burns you to a cinder. So all the lymph nodes you have all over your body, which are always there, and you feel them when you get sick, or you feel them when you stub your toe, or you get a bug bite, and the system starts to work, all of those lymph nodes were destroyed from the radiation, but the fluid that flows through them was still there. And so they gave me this compression jacket. I mean, it cost like $10,000. I had all kinds of exercises to do. It was an hour a day. I'm like, I can't do an hour a day. How am I going to go out and ride? A day is shot. And ultimately, I said, you know what? If the foam roller works all over, let's try it on my neck. And David is the one who got me to roll on my neck years ago from the discectomy. But I added this piece where I roll side to side. And I went to see the person who runs that piece of my medical care. And she does like 25 different tests, including tongue strength. And she said, I don't quite understand what you're really doing, but every test from a year ago is either the same or better. Because normally it goes from the same to much worse. Because if it's not treated, it's difficult to speak eventually. It's difficult to swallow. It's hard to move your head around. I mean, there's a hot day going by. I want to give one of these. I don't want my neck to be locked in. Give me a fucking break. So yeah, I mean, it's like a common sense thing. And one of the women in my office was pregnant. She said her back hurts her. So her shower gift was a 36-inch foam roller. Because it's like, I thought it was a tender gift. But she came to me, she said, it hurts when I roll. It's not because I'm out of shape. I said, yes, but it also should hurt. If it hurt, there's two kinds of hurt: bad hurt, good hurt. If it's a good hurt, keep doing it. And I just taught my brother-in-law, and he has no fitness at all. I said, you're going to stand up against the wall and you're going to roll from side to side on the wall, because if you lay on the floor, it's going to hurt so much you're never going to do it again. So, yeah, I mean, it's a little something like that, a $24 item. I now have 3 of them. So does that answer?
No, it does. It does answer. It does answer. It does answer the question. I really want to get into, because you and I have talked so much, and I didn't really share this with Bo, but you're now involved in the Canadian cancer, the conglomerate that they have for cancer throughout all Canada, and they've come and asked you to speak in terms of prescription. I guess this is a twofold question. First of all, what are you doing in Canada with as far as prescription? And a prescription, like Bo and I have always said, that everything's individual. The trainer has to meet you where you're at. You have to find out what works for you. This is an individual thing. This isn't just a one size fits all. But you've come into an area where you've started doing some stuff, which I believe that rolling is going to benefit anybody, period, end of sentence. But what you have done that has got Canada all over you, getting you to speak? And what is your idea in terms of, because I really want people, cancer is a mofo, it's a big pain in the ass for everybody. And if you could give somebody in terms of when they're going out there, what should they expect? Because we could ask that question, but when you get a prescription, how do you go about that prescription in terms of, you're doing this in Canada. So what's that prescription? Long-winded, yeah. Say the same thing over and over again.
Right. No, I haven't gotten there yet, but one of the sidebars with Canada is they want me to speak to the researchers, because they want the researchers to understand, because they're a bunch of eggheads in back rooms and labs. They want to understand how it affects the patient. And is there modifications you can make in your research that takes into consideration, like now a lot of the chemos, you don't lose your hair. That was because people would go out of their minds and wouldn't even do chemo if they thought they'd lose their hair, which is like, I always said, you're not going to look good bald in a coffin. So, I mean, that's up to you. Sorry, Dave. So, no, the idea of the prescription is not a bottle or a pill, although maybe it could be. The idea is, so you've got to examine what you've done in your lifetime and what you want to do, and is there psychosocial, mental, physical things that you can do that you can improve your life. Because I went through the medical shit. I met with all my medical docs a month and a half ago, and they were just like bananas how I looked and how I had done this. And then I went to the speech pathologist person who does all the sort of she's sort of the repository of quality of life. One of the things I'm doing to improve my taste is obviously not good, and my ability to produce saliva isn't very good. NYU Medical Center is now doing acupuncture. So I went for my first acupuncture session. So the point that I want to make to the researchers and all the people that will listen to me is, it's not one thing. There's not just one thing. There's multiple things. And to me, I felt better walking away from the speech pathologist than I did for my docs, because the docs is a one-stop shop. It's just one thing. I have 5 issues I'm working on, quality of life stuff. But so far, the way I'm doing it seems to be working. And if it wasn't, you know what I would do? I would change it. That's the other thing. I see so many people, they just keep doing the same thing over and over again. Have you looked in the mirror recently?
Of insanity?
Yes. David and I know all those people at the gym. They've been doing the same routine for 15 years, and guess what's happened to them? Nothing! So you know, it's David. I know we're like reaching for what's the answer, and there's so many answers that you sort of have to pull nuggets out for yourself, you know, of where they are. I know for me, having a history of, you know, all kinds of shit go on, it really helps me when it comes to making my life better. You know, it's, I say, you know, you make mistakes. If you don't learn from your mistakes, you know, it's a shame you made that mistake. But that's it. And just because you got cancer doesn't mean you made a mistake. I can tell you that. I didn't make a mistake. Maybe I spent a little too much time, like Michael Douglas says. That's why he got the same cancer. So I'll just leave that one go.
On that note,
that's
a deep cut. That's a deep cut right there. I want to be respectful of your time, Jeff. I appreciate you coming on here, telling your story. I think David might have one more big question for you.
Yeah, well, it's not really a big question. We got to leave. You got to give a takeaway to somebody, Jeff. In terms of people that are listening to this that might be going through this. What advice would you give them? And people who've been at it, who've been in it fighting, what advice would you give them? Or unless it's the same advice.
well,
I really want. Listen, I could spend hours with you, Jeff. I could spend literally hours with you about your story because I know you so well. But I want something to be taken away for the listener so that the listener can actually hold on to something. And if you have any numbers or anything that you want to put out there in terms of giving out information to people, please do.
you know, it's in terms of a cancer experience, I've been through the chronic disease, getting treated every 3 or 4 years, you know, having my life go down a little, up a little, and then having this squamous cell carcinoma on the base of my tongue. All I can tell you is radiation takes all the fun out of having cancer.
Yeah.
It's a shit show. I never realized. And my radiation oncologist said to me, he said, we try to do everything we can to let you know just how bad this is going to be. But until you go through it, you don't know it. So I also approached this cancer the exact opposite of the way I approached the first cancer. I did no research at all. I wanted to sit down with doctors and surgeons and be able to conduct a conversation, interview with them to see if what they said made sense. You know, I'm lucky I have a lot of experience, but you have to be your own advocate. No matter how many people are going to help you, no matter what they're going to do for you, you have to be your own self-advocate. So be a pain in the ass. Speak up. If the days
Demand better.
I like Demand Berman podcast.
Demand Berman. That's the next one. We'll change the name. We'll change the name right now.
Right. But you know, I think that's the biggest takeaway is if you don't become your own advocate, and it doesn't just mean in a medical setting, but it is, don't let these people fuck with you. I had a surgeon try to screw with me. He's walking around with a wider asshole than he had when he met me. Tell you that. He thought he was funny, but I'm not going to let him talk to me that way, bottom line. And if you don't like the way somebody's talking to you in the medical world, fuck them. Don't listen. Go someplace else. Be your own advocate. Stand up for yourself. I think that's the biggest takeaway I can. And then you gauge it for each kind of cancer, each kind of recovery, and all those other things. And the other thing is for those exercisers who have to go through cancer treatment, especially chemotherapy, what I can tell you is in my experience, however long you've been on the chemo is how long it's going to take you until you start to feel better when you're exercising. That's one thing I've learned. So if you're on chemo for 3 months, you're done, you start to go back to the physical things that you want to do. All of a sudden, about 3 months later, you're going to be out on the bike or out for a run or rowing a boat or doing a crossword puzzle. And all of a sudden, it's going to be, oh, shit, I feel better. So that's just a little bit of hope. But also, lastly, manage your pain. You don't have to manage it with Oxycontin. I don't mean that. I mean, Don't be stupid like some patients and say, well, I'm working during the day, so I don't want to have pain meds, because that patient darn near quit because he was in so much pain. So it was your buddy, what's his name, our surgeon, who said to me, how are they managing your pain? McCann. He said, how are they managing your pain? I said, they're managing on it, I'm not. And that led to a lot of problems that I was not thinking would occur. But because once you are in pain, it's really hard to catch up and get out of pain. And I mean deep down intrinsic pain where the light at the end of the tunnel looks like that. There's no more light. And when there's no more light, that's when you say, I'm going to hang it up. What's the point? So don't let it get to that point. That's some advice I can give you that I just learned after 33 years having only one kind of cancer to 34 years having another kind of cancer, is all of those things. Be your own advocate. Make sure you manage your pain. Do things that sound reasonable, not because they say you got to do this.
So I'm going to say this before we leave, and you can say yes or no to it. You should exercise. You should exercise. All
right, come around up.
You should exercise when you're going through this. In other words, you should try to stay as physically active. Your other piece of advice, I'm assuming, would be stay as physically active as possible.
It is if you can figure it out. Make sure that. So what I did, I got diagnosed in April. I was still rehabbing and working on my shoulder, and I wasn't supposed to ride until June. And I was like, all right, I got about a month before I'm going to go for treatment. I'm going to get back on this bike and I'm going to ride 500 miles for the month. And it hurt like hell, but I did it. I wasn't in shape. I did it in preparation for what I was going to go through. I could not exercise. I couldn't even stretch. I basically would get up, get in a taxi, go to my treatment, come home. And then when I had to go for, they wanted me on hydration 3 times a week. I had to do it intravenously. Same thing. I mean, this was just getting through life. All the other times when I've had cancer, I've always exercised. And radiation has this latent effect. So in other words, the first 2 weeks, you don't really feel anything, and then you feel something. So during that 2-week period, I did everything I could to exercise, knowing that eventually it was going to kick in. But I had no idea it would not only kick in, but kick my ass. I mean, really, you know me, David, I've always found a way to do something, even if it's rolling or sit-ups, whatever it is that I do at home. Pardon me, abs. Sure, my age. At that point, I physically could not do anything. And had I pushed myself, I would have made myself worse, not better. So it's always understanding that fine line.
I think I don't want people to walk away and say, I got cancer, and all of a sudden I got to go exercise. You just made the last point, your last sentence, I think, cleared it up. You got to manage it, whatever works for you, and you don't want to get worse, make the exercise making it worse. But with that being said, as Mo said, we really want to be respectful of your time. Listen, man, can't thank you enough to share your story with us. If our listeners liked your story and it sparked something within them, don't let it fade. Leave us a review, share the episode with friends, and subscribe to stay in the loop. And most importantly, act. Remember, we're sponsored by Fit Care Physiotherapy, where the emphasis is to focus on your fitness so you can avoid the healthcare space. Demand better from your body, your mind, and your future. We'll be back soon with more inspiring guests and thought-provoking conversations. Until then, keep demanding better. Below on the line, terryfox.org, terryfox.org. Jeff, thank you. And for everybody else, have a great Martin Luther King Day. Deuces.
How about them Cowboys?
Go Bills.